and a doctor.
I'm your co-host, Judy Grant, licensed marriage and family therapist.
And I'm your co-host, Dr. Sophia Grant, board-certified pediatrician and board-certified child abuse pediatrician.
Okay, so Candy, before we get to what we're going to chat about, I just have to comment on your glasses and your Jamaica vibe and t-shirt and how perfectly coordinated you are representing our little island.
Yes. I can't help it.
And we just got back from Jamaica, so we're still definitely
on that Jamaica high.
Yes, feeling that vibe.
And it's just like a week and a day. And I spoke with Judy. I'm like, so you want to go next weekend?
I know. We're ready to go.
For it. If we lived in Florida, we would definitely take long weekends.
Oh, yeah.
To Jamaica. Yeah.
And I sent Maya a care package of bun and bulla and Shirley biscuits and those cute little sandals, just a bunch of stuff. And she's like, "Oh my gosh, mommy." Like just so happy. She's like, "I am going to be snacking on all of this."
Well, the thing is with those Shirley biscuits that our kids love, they're actually made in Barbados.
Yes.
Did you know that?
Mm-hmm.
But my kids associate it with Jamaica, and I bought a bunch because Yaya is at summer camp and they're going to be her little kind of like sweet treat.
Yep. And I bought like half of my suitcase was just food.
Yeah. Did you stash those patties for Grayson to bring out for his birthday?
Did.
Okay,
so
good.
He doesn't, so he has a couple in his back pocket that he doesn't even know about. Yeah. Okay. So one of the things that I just thought was so super sweet was I got a text message from Maya saying that she was hooking up with her cousins, Yaya and Zachary, to attend First Friday in Oakland, just a couple days ago. And I know that you and I, we really encourage and fostered those close relationships between our children when they were children in hopes that as adults
they would choose to be with each other.
And they're doing it, Candy. They're doing it. And it just warms my heart and makes me feel like so much safer. Like when they're together, they protect each other. And I don't know, I just love it. So I just wanted to call that out. Super sweet.
Yeah. And of course, my kids didn't tell me that, but I had to hear it from you. But okay.
Oh, that's too funny. All right. So we wanted to talk to our audience today about something that's really become a crisis within our elder community. And it's not something that people automatically associate with elders, but it's really something that we need to be mindful of and take a look at. And what is that topic, Candy?
It's drug addiction. And we don't think of grandma as jonesing out for heroin or anything like that. But a lot of times due to illnesses, pain, surgeries, anxiety, depression, aging, they may become addicted to drugs. And it's not something that we are trained to look for. Maybe geriatrician, which is a doctor for older people. But a lot of the signs of aging can be the signs of drug addiction. Right. Falls, confusion, memory issues. That could also be drug addiction. Are we screening for that? So we just wanted to talk about it because we, of course, have an elderly parent, and most of our audience members have older people in their lives, or they themselves may be older people. So what is the number one drug abused by elderly people?
Well, I can't say this for a certainty, but I'm thinking it is, there's alcohol. That's much easier to get your hands on.
And it's legal. It's legal. So yeah, so alcohol is the drug of choice, a drug that's most commonly abused.
But then I'm also thinking about opioids, like again, for the pain, for the surgeries. And I know that our mother talks a great deal about her back pain. And you know, like she'll call me, I'm like, Mommy, did you take anything for that? Did you take anything for that? But what if that was a situation where she was taking too much to manage that pain? So there's a whole pain management part of this conversation that also needs to happen. But yeah, so alcohol and opioids and what? Benzodiazepines?
Yeah.
Okay. So, Candy, what is a benzo? Why would that be problematic?
A benzo is commonly used as an anxiolytic, something to like when I was in medical school, the older people would call it and my nerve pill, you know, to calm your nerves. So it's for anxiety, and some people can use it. Like a lot of adults, older adults, get anxious, and Mommy sometimes gets anxious.
Yes, she does.
And we hopefully calm her just with the presence and reassurance, and she's not on any benzos. But it depends on the doctor that you're going to, how readily they prescribe medication. As Judy mentioned, we just got back from Jamaica, and Mommy has back pain, and she went to the doctor and she needed something just in case she has back pain. And he gave her a prescription, and he said, be careful when you go through security, because this is a strong medication. I'm thinking he's giving her a strong pill. It's Tylenol with codeine. Okay. That, which is nothing, you know? But there are a lot of people, especially elder people, who have gone through cancer treatments. They may have leftover pain medication. And, you know, I think when we were thinking of this topic, Mommy has a cousin who's the same age, and she had surgery, and she was given a narcotic for pain. And this woman, she was in her 80s, early 80s at the time, said she found herself getting happy when it was time to take the medication. And thank God she had the presence of mind to say, wait a second, she shouldn't be happy to take these pills. And she ended up tossing the medication because she didn't want to become addicted. And which was, I'm so happy that she recognized that in herself. But a lot of people, especially those with social isolation, don't recognize that. Imagine if you are in your 70s, you lost a spouse, your kids are away, you don't drive anymore, and you might feel sad or anxious. You can self-medicate with alcohol. And then, of course, if you combine the alcohol with a narcotic, it can take you to loopy land where you just kind of forget everything. So it's very easy for an adult to become addicted. And then remember that the tolerance for medication, maybe they take a certain dose, because the way you metabolize things changes over time. And you may be able to become intoxicated on a smaller dose. And sleep aids like Ambien, you can get addicted to those as well. So this is a huge problem. And I thought Judy would be a perfect person, because when she was getting in her hours to be an LMFT, she worked at a drug. Was it a drug treatment? It's a rehab facility. Did you have old people in your group, or it was young people?
I had a mix. I definitely had, you know, my teenagers, and then I had my probably 70 somethings. So it was a mix. And one of the things, Now that facility specifically, um, it, people who could afford to come there. Yes, insurance was taken, but it was also a private clinic, right?
Mm-hmm.
And so this is not necessarily a resource that anybody could just walk in and find services.
Right.
So I recognize that the clientele was of a certain privilege, right?
Mm-hmm.
No matter their age, no matter their ethnicity, there was some sort of privilege there. And so these people came in voluntarily, right?
Mm-hmm.
So this is a whole different attitude and approach to addiction than those being that than those
Forced.
that are forced or have no
Mm-hmm.
self-awareness to
Mm-hmm.
recognize, like, I have a problem. So we did individual therapy, we did group therapy, but one of the things that I loved doing was our, I think they were just called family nights. It's been a minute, but those family nights where I was able to provide some psychoeducation around addiction, what that looks like, why somebody might lie to keep using, what does withdrawal looks like, what does tolerance look like, what are those warning signs, to really help the loved ones understand what they should be looking for or how best they can support. Because a lot of times, regardless of your age, people are like, why don't you just stop?
Oh my
Right?
gosh. If that's like telling somebody to with high blood pressure to calm down.
Right.
You
Why
know,
don't you just
it's
stop? You know it's
and
bad for you, just
and
stop it.
and you know the thing about addiction that a lot of people don't understand is like you have receptors in your
Yes.
body
Yes.
made to accept that medication. You have nicotinic receptors. That's in cigarette smoke. You have receptors to accept the molecules. You have receptors waiting for that to be uh, filled up, and you develop that feeling of euphoria. Like I
Right.
remember when we talked about drug addiction starting like maybe in 6th grade, and then it's like, oh, euphoria, euphoria. I'm like, what the heck is euphoria? As a little 12-year-old, I didn't know what euphoria was. You know, that
Mm-hmm.
feeling of calm, at peace, of not caring, of being at ease. And let me tell you something. When I was in labor with Boogie, and they asked me if I want something to take the edge off, and I said yes. And they gave me a medication called Stadol. This is 28 years later. I remember the medication because I felt so good. I was like,
Right.
oh, it took me until I was, what, 31 to understand fully what euphoria was, because
Right.
I was in labor and I felt the pain, but I felt so good I didn't care. And
Right.
for
Mm.
the first time, I understood how someone can become addicted to medication because, like, imagine if you're coping with your life not turning out the way you want, grief, isolation, loneliness, and you're taking this medication and you just don't care.
And you feel better. You
You
feel
feel
better.
better. And the thing is, when the effect of the medication is gone, all of those things are still present. Like
Right.
I didn't have a desire to be on Stadol when I was not in labor, but I remember how I'm like, okay, I get it. I completely understand now. And there are
Yeah.
people who the pain, the grief, the isolation, the loneliness, it doesn't go away, and you want to be relieved from that.
Yeah.
And you know, you're self-medicating. And let's not forget that, you know, you could reach your elder state and you have a lifetime of trauma that you're also self-medicating from. You could
Right.
have you could have been forced, you maybe you walked all the time, you had a fall, you can't walk, you're sad, you gained weight, and then you want to forget about all those issues. So you're taking the pain medication, you're taking the benzos, you're combining it with alcohol. It's very easy to be, especially when there's social isolation.
Right. Right. And I think most people have heard of the show Euphoria, which is more about adolescent drug use.
Mm-hmm.
Um, but they created a whole show about this, and I was actually listening to an interview about like this should be mandatory for all parents so they can start to have the conversations with their kids, right?
Mm-hmm.
And so we automatically kind of think like addiction, adolescent, young adult sort of thing. But we now need to look at that and say, but what are we doing for our elder community? You
Mm-hmm.
know, and why would someone fall into addiction when they're 73 years old? And Candy's already mentioned some of those reasons, but it's not at the forefront of our minds.
No.
It's kind of like, you know, and honestly, Mummy will say, you know, I just forgot, I don't remember, and we can see her when she gets confused.
Mm-hmm.
And imagine now if she was taking something um, that mimicked that forgetfulness and that confusion. So we're just thinking like, well, you know, this is Mummy. This is
Yeah.
a natural part of her aging process. Maybe not recognizing like, whoa, wait a second. Is there something more here that we're not aware of?
Yeah.
So it's being mindful of these things and really looking at, you know, your aging parents, your aging relatives, your neighbors, what have you, and just observing so you
Yeah.
can see if there are any changes. So I just did a little search, and I wanted to share some of those warning signs that we could look for. um, so often these symptoms are misidentified because people think that's just a normal part of aging.
Mm-hmm.
Unexplained bruises, falls, memory lapses, or changes in sleep or appetite. Now, how many of those things has Mummy experienced, Candy?
Yeah. Well, and the thing is, older people tend to be on blood thinners due to
Right,
atrial fibrillation. So you might say, oh, they're on the blood thinners, and not that mom was drunk and
right.
fell.
Mm-hmm.
And, you know, I worked at a hospital many years ago, and the director of the emergency room, his father would maybe every 2 to 3 months come in from a fall. And the father of the director of the emergency room was an alcoholic. And of course, if you're falling and you have a head injury, you can bleed.
Mm-hmm.
And that can be the beginning of the end.
Right.
And remember that alcohol in the elderly is going to be metabolized different, and they're going to have more impairment at a lower dosage of
Right.
alcohol in their
Right.
system.
Hey, Candy, scooch over just a little bit. I
Oh,
want to see you
sorry.
centered. Okay. Okay.
Okay.
Yeah, better. Okay, so now that was more physical symptoms. Now we're
Mm-hmm.
talking about behavioral, social withdrawal, neglectful personal hygiene, lack of interest in previously enjoyable activities,
Mm-hmm.
and we often see that just under the diagnosis of clinical depression.
Yep.
Right. And so our elders might be experiencing some of that depression, some of that social withdrawal, um, for any number of reasons. Like Candy mentioned, the loss of a spouse, a partner,
Mm-hmm.
the fact that your friends are now passing away, and
Retirement, boredom.
just so many different things. So I don't want this to be like, oh, they're just depressed. Let's look into this. Let's dig a little bit deeper and find out what meds they're taking and for what reasons, and could any of these medications be the impetus behind these behavioral shifts.
Elderly people forget to take medication.
Mm,
They may
yes.
take medication twice. They may not take it at all. They may not
Mm-hmm.
take it for several days. And then they may have the thinking that, oh, I didn't take it yesterday. Let me take 2 today. Like, remember when you bathed several times in a row so you wouldn't have to bathe the next day? Remember that?
Yes, I do. I remember that.
But, you know, it sounds silly and you were a child, but a lot of adults kind of revert to that childlike thinking, and where it won't make any type of sense.
Right.
So, yeah.
You know, and our mother, I mean, she's relying upon us for her getting out into the community,
Mm-hmm.
you know, go to the supermarket, go to the doctor, the dentist, what have you. So this isn't something that she could do on her own.
Mm-hmm.
The doctor shopping. You try
Yeah.
Dr. Jones, and then you go to Dr. Smith, and you go to, Dr. whomever, in hopes of getting more and more of these prescriptions.
Mm-hmm.
And thankfully, our mother is not in this situation, and we're also very much involved in the medications that she takes, and we know what she takes,
Mm-hmm.
so on and so forth. But if you hear of a loved one visiting multiple doctors,
Yeah.
you need to ask yourself why. And I'm
Right.
not saying, like, our mother has her primary care, she has her cardiologist, she's having an pain management, yada yada. I'm not talking about those specialists. I'm talking about going to different doctors seeking medications
Yeah.
to fulfill this need that they're having now.
Right. What you also need to remember is even at a prescribed dose, it's easy for elderly people to become addicted.
Mm-hmm.
So the doctor shopping, there are certain things in place that make that less easy to get medication, because your name will go into a database when you're getting. So people who are truly addicted and truly trying to game the system may use a different name, or buy it on the street. We're not talking about that level of addiction. We're talking about the hidden addict, the hidden person who is dependent. I have a friend from high school whose mother has suffered chronic pain, and maybe a couple of years ago she was like, "Mom is losing it," and then when she actually went through the medication, her mother was being overprescribed and just taking the medicine from the different doctors as prescribed, but it was too much. And so this non-medical person said, "Mom, this doesn't make any type of sense," and weaned her mom off of this stuff. And her mother went back to her baseline, and she was like, "Oh my gosh, she was being over medicated."
Mm-hmm.
So that's an issue as well. And there's some doctors who just throw medication at you rather than figuring out the source. Your headache or your back hurts, or let's treat the pain rather than the source.
Yeah.
Or the cause. So I mean, I think this is a reminder that sometimes adults, your parents, need supervision. You need to go with your elderly relative to the doctor, go through the list of medications, figure out what the dosage is, talk about what's going on, because I cannot trust mommy to go to the doctor and describe her symptoms accurately, because she has back pain. She'll walk in, the doctor will say, "What's your pain level?" 10. So mommy, your pain is not a 10. 10 is labor pain, but it hurts a lot, but it's not a 10, mommy. So of course, if you're a physician, this woman walks in and says she's at a 10. What are you going to believe? What are you going to, and we're taught to believe people when they say they're in pain. So, they frequently will need a second person to supervise all of that.
Yeah. And and it's mommy's been doing this for years, and this is just a strategy that you could employ. Our mother has written down all of the medications that she takes. So if she goes to a new doctor, she has her little brown little notebook that she opens up, and she can give this to the doctor and say, "This is what I'm taking." And I think that is smart for so many reasons, just to make sure that if there's a new medication added, it's not going to be have like a negative response from something that she's already taking.
Yeah.
But it also helps me know, like, what the heck is going on with my mother. What does she need on a daily basis? And the reason for the meds. So I think that is a nice little strategy to employ. Keep it in your notes file on your phone. So when you go to the doctor, and include the dosage, include how many times of day, so you can speak confidently with your parent or friend's doctor about this is what they're taking, this is the dosage, so on and so forth. And that helps the doctor too, so they don't have to be trying to investigate. You already have the information on hand. So I'm looking at common triggers. Unlike younger populations, late onset addiction is often driven by the unique cumulative stresses of aging. What about moving from independent living into assisted care or a retirement home?
That would depress the hell out of me.
Exactly. Think about I'm watching a show right now where they're talking about that. Think about how now you're removed from your environment, from everything that you've known, and how you might want to self-medicate to manage that loss of independence, loss of freedom, and isolation.
Yeah, suppose you lose your license. Somebody, your kids say you can't drive anymore.
Right.
Yeah.
Managing chronic medical conditions and persistent pain.
Yeah. Again, arthritis, back pain, surgical site pain, neuropathy. Remember that, after you have cancer, cancer treatment, you can get neuropathy. That's like tingling in the hands and feet, and it's uncomfortable, and you get pain medication for that. And then cancer-related pain. Cancer hurts.
Yeah. Yeah. Feelings of loneliness, loss of purpose, or financial strain.
Feeling like you're a burden on your family.
All of these things play into, that trigger for starting to use. And Candy, you mentioned this increased sensitivity to drugs and slower metabolic rates, making standard dosage much more potent. So again, things that we just need to be mindful of. And then this goes on why it's hard to spot, because a lot of these things seem like a natural part of the aging process. So we're not really blinking an eye when daddy forgot where he left his keys.
Shoot, I could be a drug addict if you use that, And then falling is another thing. Cognitive decline, inattention to hygiene. Remember that, stuff like taking a shower, that's super easy, is more difficult when you're older. You could need a shower chair. You could be afraid to shower if there's nobody else in the house. And then, say you visit your mother once a week and she smells and you're like, when was the last time you took a shower? And you could attribute that to, all the things I mentioned. But maybe mom is like on drugs and sleeping and forgot to take a shower, or it doesn't bother her that her hygiene has declined.
Right. And I think some of this, as we're talking about it, it feels kind of scary. It's like, whoa, my mother does that. My mother does that. But this isn't to say that all of these behaviors are related to addiction.
No.
But I think what you want to know is like, what's the baseline for your parent or your loved one? What does that look like on a Tuesday? And then how does it compare 5 months later when, like, wait a second.
Yeah.
This doesn't feel the way it did before.
Yeah, but
could something else be going on?
Remember, sometimes when you're caring for somebody and they decline, it happens slowly enough that you're unaware. It takes somebody who has not seen them in a while to point out the stark difference.
Right, yeah.
So
that's a really good point.
That can happen as well.
Yeah. Yeah, that's a really good point, because again, just in Jamaica, we saw a lot of family and friends, and there were a few folks. It's like, they don't look like themselves or the way I remember. And again, all of our mother's friends, our cousins, what have you, we're all getting older, so probably most of us don't look exactly the way we remember.
Yeah.
But to be able to point out that stark difference.
Yeah. And then also remember, medications can interact.
Yes.
So there's medication interactions, and then there is liver damage. You know, most medications are metabolized through the liver.
Mm-hmm.
And if you're on a lifetime of medication, you can have liver damage as a result. And then if you're drinking alcohol, which is metabolized through the liver, that can affect your liver. And let's just talk about alcoholism. If you feel that your loved one drinks too much, I guarantee they drink way too much. Because what somebody who has an alcohol problem drinks in front of you and you're thinking, that's a little bit too much, they're drinking way more in private.
Right.
And I just had the sibling of a dear friend of mine die. And last time I saw them, they said, I think they might have a drinking problem. Turns out it was way worse. Mm-hmm. And they drank themselves into an early grave.
Yeah.
But the private drinking was way more.
Mm-hmm.
Yeah.
Yeah, like when you are drinking in secret.
Mm-hmm.
Yeah.
Yeah.
That is a telltale sign.
Yeah. So if what are the questions? Like, do you need an eye opener? What is it, Cage? Do you need an eye opener? Or remember the acronym for the questions to ask to see if you have a drinking problem? E is for eye opener.
I don't remember that acronym.
Oh my gosh.
I have them for all of these other diagnoses, but I can't think of that.
I mean, of course, I went to medical school in the late 80s. Let me look it up.
Okay.
Cage alcohol screening.
Okay.
Cage is widely used. CAGE. Have you ever felt that you should cut down on your drinking? That's a C. A, annoyed. Have people annoyed you by criticizing your drinking? G, guilty. Have you ever felt bad or guilty about your drinking? E, have you ever felt that the first thing you need to do is have a drink as an eye opener?
Okay.
You never learned that?
No, I didn't. No, even when I was in my substance use program.
Yeah. So if you score 0 to 1, you're low risk. 2 or more points, it's clinically significant.
Mm-hmm. Okay,
so
that's good.
So the Cage questions. Now I have a joke. I mean, although alcoholism is not funny, but I shared it a couple weeks ago. My paternal grandfather was an alcoholic. Our parents never drank. Like mommy and daddy, like if mommy would drink something, it was just kind of like Manischewitz wine when she's making stuff, but they always had a stocked bar because they felt that like to be gracious and hospitable, you have a stocked bar. So mommy and daddy never drank.
No.
And back in the 80s, wine coolers were popular. Remember Bartles and James and all
Loved
of that
them.
stuff.
Yep.
It was essentially wine plus 7-Up. And we had a like a Memorial Day party. And Judy, you and I were sharing a wine cooler.
Yes. And mommy said, mine you turn alcoholic on me.
Watch it. We were sharing a drink and my mother was concerned.
Yes.
And then I would say maybe a week later, nobody was home. I was eating. We're a juice family. We drink juice with our meals. And I found a leftover wine cooler. So I'm eating my dinner, lunch, whatever. And I'm having a wine cooler. And mommy walks in the house and she sees me. And she says with her full chest, so you're drinking alone now? And I was like, you know what? this is ridiculous.
It's not worth it.
It's so not worth it. And I don't drink in front of my mother anymore. Mm-hmm. And this is before Daddy died. So 37 plus years. And if you were to ask our mother right now how she felt, she would say, I really thought she was drinking too much. I thought it was a problem. Mommy would swear. And I'm like, 2 wine coolers. No, 1.5 wine coolers.
Yes.
In 2 weeks. And yeah, so
and you have
that is how we have been raised to not consume alcohol. And I'm just like, it's so not worth it.
Yeah.
But for other families, it's kind of like I know a woman who, like, when her son turned 21, gave him scotch. That is just like that. Like, I would never do that. That's a very alcohol centric thing. Like it was just like, it was really cringy to me. Mm-hmm. But I have raised with different values and a different take on alcohol and alcohol consumption. And I have to tell you, I have a little bit of that mummy in me when, like, my kids are consuming alcohol. Like, so what's with, the wine? What's with this? What's with that? And I'm not as bad as Mummy, but they're just like, do you realize you're repeating the cycle of shame? Right. But yeah.
Mm.
Yeah.
That's exactly how we were raised.
Mm-hmm.
So I wanted to share some, just to put some hope out there. This isn't the end. There are treatment programs available for our elders. There is, gradual detoxification, but I do recommend that should you have someone going through this, that is done with the supervision of a medical professional.
Definitely.
Because withdrawal itself is a bitch. And you do not want to take that lightly. You need to be supervised as you're going through that. Behavioral therapy, cognitive behavioral therapy, where we start maybe addressing some of those triggers that you might have, or some of those past traumas that had not been processed yet. And you find yourself self-medicating as an elder. We also have group therapy. So you recognize that you're not alone in this. There's no shame. We don't want you to feel shame. Like, oh my gosh, I started using when I was 76 years old. Like, how ridiculous. No. Let's just admit that there's an issue and seek some support. And I think when you're sitting in a group of your peers, recognizing that you're not the only one, it helps to normalize this experience for you and for everybody else. So it's those are just some of the things that we can do to help manage and hopefully move that person out of active addiction into recovery. But, be sure to loop in the doctors and let them know, because we don't want you to have this information and not share this with your doctor, because the doctor might just decide to prescribe some other medication that's now going to put your loved one back into it when you're working so hard to get out of it. So there are a lot of things that you can do, but I think in order to help move that person through active addiction into recovery. But I just want to encourage, like, observe, take note, listen, what's going on. And just be an active participant in your loved one's life, so you can hopefully sense any changes in behavior.
Right. And the same stigma that's keeping young people from getting treatment is going to be kind of heightened in the elderly, because it's an embarrassment to be in your 70s and to be addicted. Like, what? So, give people grace. And then also remember that the interesting trend is the baby boomer generation has a higher lifetime rate of substance use than previous generations. And, our parents are baby boomers.
Yeah.
So, and, I have a friend whose mother was an alcoholic. And when she would go to the doctor, she's like, oh, I have a cocktail every now and again. It's like, no, you don't. You're stinking drunk every night. And like my friend had to let the doctor know that alcohol consumption was not accurate. Right. So don't be afraid to, you're actually advocating for your parents by telling the truth. Don't perpetuate the lies because doctors, we don't want to be functioning in the dark.
Yeah. And, another thought that just occurred to me, don't buy into this. Well, they're older. Let them do what they want.
I know. Because guess what? Yeah. I mean, imagine an older person with an alcohol problem still having a license. And we've seen it where the older person mows into the farmer's market, kills 5 people.
Yeah. Yeah.
Blows through a stop sign, runs over a kid. And then they're like arrested and confused. And, that, I mean, of course you have the implication for self-harm, but there's also an implication for harming others.
Yeah, for sure. For sure. So, I don't know. We just felt like this was a topic that needed some discussion. And, I pray it doesn't resonate with anybody, but if it does resonate with one person, then fantastic. And, you have some, maybe a few more tools in your pocket to utilize with that loved one. And if we're talking to you and you find yourself in active addiction, know that our thoughts and prayers are with you. And we sincerely pray that you're able to seek the help that you need.
Yeah. Although thoughts and prayers kind of means nothing now, because it's frequently used to pacify people when, school shootings. So I just, I don't even like that expression anymore, but we support you. We get it. We don't stigmatize you. We don't judge you. But if you find yourself needing an eye opener, being annoyed, feeling guilty, feeling like you have to cut back, those are all things that are true. I have a friend who's an alcoholic and she has said some things to me, but she's never sought treatment, and I think a lot of people recognize that there's an alcohol problem, but it's really hard to broach that subject. It really is.
Yeah. Well, we want to thank everybody for joining us for this episode of Tusoka. As always, your presence is greatly appreciated. If you're enjoying these conversations, please let us know. Would love to hear from you. Candy, how can our people reach out directly to us?
TuSokaPodcast@gmail.com, Instagram, Two Sisters of a Certain Age, YouTube, Tusoka.
All right. Thank you, everybody. Until next time.
Bye.
Bye-bye.
No Longer Network.